The land is good, the land is fine. Gold we have, diamonds we mine. Yet we fight, we cover it all in blood. Tell me why we wallow in the mud. Africa, 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 yeah. Mama Africa, we cry for peace. Africa.
Hi, my name is Elliot Koranteng Tannor. I'm a physician specialist and a nephrologist at the Komfo Teaching Hospital. Today, I'm going to discuss with you how to screen kidney diseases. We have had some presentations basically on what kidney disease is all about, and I've mentioned why it's such a problem in this country, and people are asking me if I'm making such a big deal about screening and prevention, then I think it's in order that we get a video to educate us on how we can screen ourselves. So as you are watching me now or you are listening to me now, if you want to know, do I or do I not have kidney disease, what do I do? And that is what this whole video is about, and I pray you join me to the end. Now, we've mentioned as part of the introduction that kidney disease normally will present without symptoms. Yes, it presents without symptoms in majority of cases. If that is the case, then we don't need to wait for the symptoms I elaborated in our previous video to worry about it, because like I mentioned, if you are waiting for them, you probably might be too late. So the question now is, who do we screen for kidney disease? We screen people who are at risk. What do I mean by people at risk? If you happen to have any of the risk factors that will cause kidney disease, then I advocate that at least once a year or twice a year, make sure you find out how your kidneys are doing. And I would explain how we can do this. Now, which risk groups am I talking about? Are you diabetic? Do you have diabetes? Does your family, anybody in your family has diabetes? If that is the case, I recommend strongly that you, one, check to see whether you have diabetes, and then two, check to see whether if you have kidney disease virtually every year. Two, are you older than 40? Indeed, that is what the textbooks tell us. But from my experience, I have patients who are 20s and 19s and all who come with end stage. In fact, there are kids who also have kidney disease at the end stages. So what I advocate is that at least above 20, above 30, if you find a time, check to see whether you have kidney disease. And like I said, I would explain how to screen for these. Do you also have hypertension? I mentioned earlier, hypertension and kidney disease is typically like the chicken and egg situation. If somebody comes to me with both, sometimes I'm not too sure which came first. Is it the diabetes or is it the hypertension? And in this, you realize that most of the times, more especially the young people, when they come to me and they have hypertension, chances are that there's some underlying kidney disease that is causing the hypertension. In that case, you need to get screened every year. Some studies we did in Ghana shows that about half of our hypertensive patients have kidney disease. Yes. So if you have hypertension, you need to check every year to find out at least whether there's something going on with your kidneys. Again, if you are older, like I've mentioned, if you have diabetes, you have hypertension, or you have a family history of kidney disease or hypertension or diabetes, like we've said, then you need to screen. Are you older than 50, probably a male with a prostate problem? You need to screen yourself for kidney disease. In any case, you should also know that in any case, there are other conditions like polycystic kidney. That's a mouthful. That's a lot. But you should know that polycystic kidney is common in Ghana. So there are people who have sort of some cysts. And what I mean by cyst is that collection of fluid within their kidneys. It runs in families. It's no fault of theirs. It's no fault of their families. But then it happens. And how do you know you probably just need to screen yourself. So when we screen to see that you have hypertension, we follow up to find out what is happening with the kidney, and that is how we are able to pick these things. Now, if you have been abusing painkillers, I know our women with knee problems, back aches, and the old men, they keep on taking all sorts of pain medications over and over and over and over again. If that is the situation, then you predispose yourself to kidney disease and you need to be worried. Are you too big, as in obese? Is your weight a burden? If the bigger you are, the higher your risk of getting kidney disease. I could go on and on and on about the risk of kidney disease, but this video is mainly about how do we screen ourselves. So when you identify as a risk yourself, then of course I recommend that you get yourself screened after watching me from this video. If you don't have any of these things, don't say, oh, because I don't have, because I mentioned that sometimes people have it without knowing, and they may not have even hypertension at all. So then my suggestion is that in any case, at least once a year, just go get yourself screened. What can you do? Simple urine sample when you send to the lab. We can do tests to try and find out whether there are substances in your urine that will suggest whether you have kidney disease. We call them blood or protein. These things are not supposed to be in your urine, and if they are, it tells us that there might be something going on with your kidney and we need to find out. It's not too expensive to get your urine checked. If you check your urine and probably there's a problem, then we go on to do further tests. Sometimes we draw blood from your veins and then we send them to the lab to try and find out. There's a substance in our body. We produce it normally called creatinine. If this is the first time you are hearing it, it's a mouthful, creatinine. And this helps us to know how well your kidneys are functioning. So when we check your creatinine and it's a bit on the higher side, it tells us that there's something going on in the kidney. It might be something that may have been there a long time ago or probably suddenly, and we need to find out and be able to help you. Another thing that we do that helps us to know whether there's a kidney problem is to do an ultrasound of your kidneys. What do I mean? When you do the ultrasound, what the women do to know about the state of their babies in their bellies is the same thing, but this time around we are looking specifically at the kidneys. One thing I would let you know at this point is that the kidneys have a normal size. The normal size of the kidney is about the size of my fist. So if you make a fist at this point, you realize that the kidney is about the size of your fist. Meaning that our fists are different, so we have differences in sizes of kidneys. The bigger you are, the bigger your kidneys. The smaller or shorter you are, the smaller your kidneys. So we judge your kidneys' strength by probably your size. But averagely, we know that the kidneys are about what? About 10 to 12 centimeters in length. When we look at the kidneys and we realize that there's something that is going wrong, i.e., is it too big or probably too small, then there's a problem we need to pursue and then find out. Now, when you have done these things, it should quickly let you know that are my kidneys okay or not. I would at this moment advocate that you see a certified nephrologist or a physician who knows how to screen these things, because the interpretation of most of these labs need a bit of professional touch. So you need an expert to help you understand these things. The next time you visit your hospital, if you're a diabetic or you're hypertensive, say you've watched this video and you are being told that you should screen yourself at least once a year, or better still, even 6 months if you can afford. Because it is very imperative, because if you don't look and find that there's a problem for us to look for solutions early, we run into trouble. In conclusion, how can we screen? Urine sample, blood sample, and then doing an ultrasound of your kidney are basic ways by which we can tell the state of your kidneys. If you've not had it done, I suggest you get it done. If you have a high risk, diabetes, hypertension, and probably even if you don't know, screen for these things. Go get your blood pressure checked. Go get your sugars checked. Let us know whether you have a risk. Talk to your parents. Let us know whether you have a risk, because I say that your kidneys' health is your own responsibility. You may be visiting the doctor forever, but if he doesn't suggest it, at the end of the day, you are the one who is going to get the kidney disease. So suggest to your doctor, politely of course, that, oh, because of your diabetes, you've heard that you need to screen yourself at least every year in terms of your urine and then blood. And I think it will go a long way to prevent you from getting kidney disease, because if there's anything, we can pick it early. Thank you very much for watching this video. If you have any questions, if you have any suggestions, if you have any recommendations, we are open to hear them. You can follow us on channels that are rolling below us now and be able to inform us if there's anything else you want us to talk about. We'll be happy to answer all your questions. God bless you.